Hi everybody, Dr. Kerry Yerkew here. Thank you for joining me today for this webinar called Discover the Power of Chiropractic, Transforming Lives from the Inside Out. And I'm Dr. Kerry Yerkew. I'm a chiropractor here in Kelowna, British Columbia. And today we're going to talk about chiropractic, how I practice chiropractic, and what you can do to embrace the chiropractic lifestyle. So make sure you stay tuned until the end of today's webinar because at the end of the webinar, I'll give you a special offer to follow up on the webinar today. So whether you live in Kelowna or you're not living in Kelowna in another area, I will give you a special offer to be able to follow up on some of the ideas that I talk about today. So have you seen a chiropractor in the past? Yes or no? And if you can answer that question, right here, right in the chat, just type in there whether you've seen a chiropractor in the past. The reason I'm doing this webinar today is we want to change and save people's lives. So basically, our goal here in the office is to change and save lives in our community and beyond our community through webinars like this. And we want people to get relief from their pain. That's why they come and see us in the first place, is they're in pain or discomfort. They want to reduce their pain or eliminate the pain and restore the body's function. And we want to encourage our patients and viewers like you to have a better quality of life. So we really want to talk about the chiropractic lifestyle and how that's different from other types of lifestyles. My qualifications, I'm a chiropractor. I've been practicing for 30 years now. I've seen over 10,000 patients in my career through locums when I first started practicing. So I worked in various clinics taking over for chiropractors that were on holidays or injured or sick. And then I started my own practice, and I've practiced solo on my own. I've also had group practices where I've worked with multidisciplinary settings. So I've really had a varied experience, but I've been a busy chiropractor for my entire career, and I've seen a lot of patients. And I wrote these books, one of them on back pain right here. It's on Amazon, and I'll tell you about that later. And another book on neck pain that came a year later. And so I'll be talking about some of the points that are in the two books today. Just a disclaimer, if you have conditions that we talk about today and you want to try something new, it's best to talk to your health professional before you start something, because these recommendations may not be best for your specific condition. So what I'm talking about today may be helpful for some people, and some of these changes could be helpful for different groups of people. So make sure you talk to your health professional before you start something new, because everybody's different. So I think that's important. I'll talk about that today, as well as how I get to know my patients and how I make recommendations to my patients. My story, I suffered from knee pain as a teenager, and my parents took me to our GP, our medical doctor. He examined my knees. He said I had growing pains and I'd grow out of it. And the knee pain continued. In fact, it got worse. And what happened was we went back to the doctor, and it took several visits, and the doctor continued to say that I had growing pains and don't worry, I'd grow out of it. But then my father heard of a chiropractor that was at our church, and he took me to the chiropractor, and the chiropractor was the first one to examine my knees and take x-rays. And when he did, he found the problem. He diagnosed it. He told me what he was going to do to treat it. And his treatments over a few months really helped me to get rid of the knee pain and to be able to function at a higher level. And that allowed me to play sports. Like I loved playing soccer on the playground with my friends. I was playing hockey at the time, and I was very ambitious and I think a good athlete, but because of my knees, it was holding me back. So what happened was when I had these treatments, it allowed me to move past that barrier and get to the next level. And that's how I think about it with my patients too, is their pain and dysfunction is holding them back from going to the next level. 3 things that I want you to take away from today is how chiropractic works. So that's going to be important. How I practice chiropractic, which may vary or differ from other chiropractors, and what you can do to live the chiropractic lifestyle, which I think is very important. I've certainly benefited from the chiropractic lifestyle personally, and so has my family over the years, because I grew up with an aunt and an uncle who were chiropractors in a different province in Canada, but nonetheless, they talked about chiropractic, the chiropractic approach, and because it was a different philosophy, it really inspired me to kind of dig into that a little bit deeper, and I'm going to touch on that today. So what is chiropractic? Well, it all started with the subluxation. And the subluxation is a bone that's out of place in the spine. It can happen in other parts of the body too. We'll talk about that as well. But when you have a subluxation or a misalignment, it interferes with the electrical activity, the nerve flow going through the body. And the body needs this nerve flow because that energy is sending signals from the brain to other parts of the body and from the body back to the brain. So there's this electrical system in the body, and every cell in the body is connected to the brain through this electrical system. And every cell in the body needs a spark of electricity. It basically needs that electrical current, those messages, in order to function properly. So the whole body is interconnected. You could call it the Internet of Things in the body, and those cells are taking direction from the brain, and those are our thoughts and emotions and those automatic processes. So chiropractic started when a person, Harvey Lillard, came to Dr. Palmer, who was studying the spine, and said that he had fallen and got injured, got a subluxation or a bone out of place at C1, right at the top of the spine, and couldn't hear very well out of his ear. And he had lived like that for years. And he asked Dr. Palmer if he could put that bone back in place, would the nerve flow and the hearing come back? And Palmer theorized that if he could reverse that, then the body would function better and the hearing would be restored. And that's exactly what happened. Dr. Palmer adjusted the spine, the nerve flow was restored, the organ functioned better, the hearing improved, and that's how chiropractic was born. So the same principle applies to chiropractic today, that subluxation in the spine interferes with the nerve flow, and it's important that we find the subluxations and adjust them so that the nerve flow can improve and the body can be stronger and healthier. So really what we're doing is removing interference in the body, because the body does have a potential to heal. We have that innate potential, and an example of that would be when you get a cut or a bruise, your body knows how to heal. It reorganizes itself without you having to do anything. It'll regrow tissue, it'll heal the tissue, it'll get rid of the scar tissue. So there is that inborn or innate mechanism, and we do have that power within to heal properly. But if the body's being interfered with, let's use that cut as an example, and you continue to irritate it, you continue to get it dirty, it's not going to heal properly. It's going to continue to be irritated, and it may not heal properly if that's the case. So you've got to wash it, you've got to keep it clean, you got to take care of it to allow the body to do its thing. And that's what chiropractic does. We find the subluxations, the interference, adjust them, allow the nerve flow to get through so the body can perform to the best of its ability. And so the other thing I want to touch on today is, sometimes people ask, well, is it okay for kids to get adjusted? And the answer is yes. Babies, infants, toddlers, teenagers like me, when I first started, as the spine grows and the nervous system grows, it's important to keep it free from interference. Make sure that we have the proper nerve flow going through. Kids are falling all the time. the birth process. There can be misalignments from pulling the head and twisting the head. So there's a number of reasons why the body can get subluxated or have misalignments. And then the other thing that I think is important going forward, and maybe this is more for adults, is our thoughts and emotions also create electricity and create a reaction in the body. So often I'll talk to my patients about that mind-body approach, how important that is to the healing process in the body. And things like stress, things like your environment, the food you eat, all of that's important to create positive electricity versus negative electricity or a stress response in the body. So I'll touch on that a little bit today, but if you want to know more information, I'll give you an opportunity to join me for a follow-up at our masterclass or a visit in the clinic. So electricity is created in the brain from our thoughts and emotions. The internal part of the brain, the midbrain right here, has a lot of the primitive reflexes, the emotional center, the coordination center back here in the cerebellum, and then the thoughts are more on the top part right here in the cerebrum. This is more of our conscious thoughts. And so they're all interacting to create signals that start to go down this spinal cord right here. You can see C1, the first vertebrae. This is where the first adjustment was done by Dr. Palmer to Harvey Lillard right here. And so C1 is a very important area, but the nerve flow comes from the brain, goes down the spinal cord, and any misalignments here in the spine, these are vertebrae, can cause pressure on the spinal cord or the nerve roots interfering with the nerve flow. The interaction you have with your environment, your surroundings, very important. Some of the thoughts and emotions that are created are due to the way we've been raised, so our upbringing, childhood. We have ways that we've been trained to deal with certain circumstances, certain life events, and so we filter our thoughts and emotions through these learned behaviors over time. The good news is if certain things are causing a stress response for you, chiropractic treatment in conjunction with learning new ways, a new lifestyle, new behaviors can be very beneficial to you going forward. So we can basically override some of these thoughts and emotions if they're causing us stress, using the conscious brain to override the primitive brain, the subconscious, if that makes sense. Now it takes some work to do this, but it can be done over a period of time, and that is something that often at the next level, when I start to correct someone's spine, talk about wellness and a healthy lifestyle, I start to talk about these things and educate my patients about it. So chiropractic is an innate approach, basically works with the innate healing ability in the body, keep the body in balance so it's functioning properly, allow that healing mechanism to take place so the body gets stronger and healthier. And chiropractic removes interference. So I put a rock right here on this garden hose, and sometimes I use a simple analogy that if there wasn't water flowing through the hose, i.e. the nervous system, then you would look at the end of the hose here, you'd be looking at through the hose, looking if there's any blockage there. You might even take this nozzle off at the end and look if something's clogged there. But meanwhile, the blockage may be up the line quite a bit here at the rock where it's on the hose. And the similar concept applies to chiropractic, because sometimes we have patients that have numbness in their fingers, let's say, and they're rubbing their fingers and they want to get that feeling back, but meanwhile the bone's out of place in their neck, blocking the nerve flow going to their hand. Or similarly in their foot, they have pain in their foot or pain in their leg, but the problem is that there's a bone out of place in their low back, pinching the sciatic nerve. So this is the rock on the garden hose concept, and by a chiropractor removing the rock, allowing the nerve flow to get through, then the flow is restored. Now, the second part that I want you to take home today is how I practice chiropractic. So in my clinic, I take a structural approach to chiropractic. I look at the alignment of the spine, the posture of the body, look for the normal curvatures, if anything's abnormal, like a scoliosis or a twisting of the spine. And I do a thorough history to understand the background because every person's different. So really, I want to make sure that that we're really looking into that person's background. And if there's been injuries or accidents in the past, certain life events, that could make that person's spine different from another person. So let's say two people came in with sciatica and one person had a different history than the other. The way that I approach that sciatica may be different, even though it's a similar condition. So I want to understand the patient's history. I want to do an examination to pinpoint the cause of their pain and discomfort, their problem. And then I do tests like x-rays, postural assessments, postural pictures, orthopedic and neurologic tests as well. And this is to pinpoint the exact cause of their problem, and then we start to treat that area. I do look at other joints in the body, and some of the other joints that I treat are the shoulders, the hips, knees, ankles, wrists, TMJ, the jaw joint. And what I look at is the alignment and the posture of those joints, the function of the joints, the ranges of motion, and then what I want to look at is the tone of the muscle around that joint and how that ties into the overall, the big picture of the posture and the alignment of the body. So sometimes what we can have is the shoulders are uneven. Let's say the posture of the patient is poor and they don't have any neck pain, but because the neck and shoulders are out of alignment, it's putting more strain or wear and tear on one shoulder compared to the other. So then what we want to do is not only treat that shoulder, the ball and socket, but we want to make sure we have the proper posture and alignment of the neck and the upper back so it supports the healing of the shoulder. And so that's what I mean by looking at the other joints. Now, the type of adjustments I do in the clinic, they're traditional adjustments like hands-on manual adjustments to realign the spine and to improve the function of the joints. I do use more contemporary methods like instruments, the activator, integrator, to do adjustments to the spine as well. So some patients respond better to instrument adjustments than the hands-on. Others respond the other way. Tables, I use tables in the clinic to do adjustments, popping the table up, pushing down to do drop adjustments. And that just helps, especially with heavier areas like the hips, to realign the hips and to get them balanced. I use decompression in the office. I use the Y-strap, and you might have seen that on social media, Y-strap adjustments. But I use that to decompress the disc and provide more space between the bones. It even makes it easier for me to do my adjustments that way. So it kind of ties into the treatment that I do in the clinic. Now, other modalities I use in the clinic, shockwave is one of them. Shockwave sends an impulse into the body, breaking up scar tissue and crystals like calcium deposits, and it improves the healing ability of the tissue in that area. So I'll use shockwave on the knees, on the feet, on the wrists, along the spine. Similarly, cool laser or soft laser, I use that in the clinic to promote the healing. It's a light therapy, different than shockwave, which is more of a mechanical force, to promote healing in that area. And another service we offer is orthotics. So sometimes people are not standing or walking properly. They have pronation of their foot or supination, and it's important for us to get the posture realigned, including the feet. So how do I make a plan? Well, when I first do the assessment and I start treatment, I usually give it about 2 or 3 visits to see how the patient's responding, and then I go over the results with them in a video format like this. So I'll record a very specific plan for that patient. I will send them the link to it, and then they can watch how I assess the spine. So I'll draw lines on the postural pictures. I'll review any x-rays with them, and then on a spreadsheet, I'll put together the plan going forward. And the plan will involve treatments, anything they need to do at home to help themselves, how many visits, and when we're going to do our reassessment, and where I expect to be at that reassessment. So let's say The plan is for 1 month or 2 months. I might say after a month or two, I expect to be at around 80% recovered, or 50%, or depending on their condition, what the expectation is over that period of time, and why I'll be doing the reassessment to track their progress. I do want my patients to participate. Initially, I might just give them ice and heating instructions to help them. But down the road, we want to do some stretches like yoga, cat and dog type stretches. We want to do some rotation type of stretches. And then we want to start with strengthening and lifestyle choices to support the healing process in the body and to maintain it. So what are some of the lifestyle changes that you can make? One is just getting more active. So as your body heals, more physical activity, and that can come in a variety of different ways. The stretches, the exercises, the core strength, some cross training, some cardio, all of those are very important for the healing of the body, because the body likes to be used, and as it's used, it actually gets stronger. So I know initially when the patient comes in, they're in pain and discomfort. We can't get that activity level increased at that time, but as they start to feel better, we can start to increase the activity level gradually. If there is a lot of mental stress, emotional factors, then I'll address that as well. So some things that the patient can do, like breathing exercises, meditation, yoga, things like defining their boundaries better, and dealing with the stressors are very important. Sometimes I'll even recommend other services like BetterHelp, or going to see a counselor to help with the stress that they're feeling, so they can kind of rewire their brain, find different ways of dealing with these stressors. And then nutrition. Not only will I talk about macronutrients like protein, carbohydrate, healthy fats, fiber, but I will also talk about supplements. Different types of supplements like collagen that can really help to heal the body and the soft tissue so it gets stronger and healthier. So as treatments progress, I'll talk about these supplements, usually in the corrective part of care and when we're getting more to maintenance and prevention. So what can you do? Well, you can take action today. Just change one thing. So when you leave this webinar today, make one change. Maybe a thought came into your mind today during this webinar, and you thought, yeah, I could eat better, or I could exercise, or my posture, I can improve on that. Or yeah, I should book an appointment to go and see the chiropractor. So take action. As soon as we're done, do that activity, and then just follow up tomorrow and just start to make that part of your routine. Just one thing. And by taking those baby steps, you can make small changes that lead to bigger changes. Practice it. It's not going to be perfect. You might struggle with it. Just starting the activity is halfway to success. So just starting to do something and repeating it, and then you'll get good at it over time. So just commit to it and keep that repetition going, and eventually it'll become a good habit for you. So you can choose a more natural lifestyle. That's a good way to do that. Improve your food quality, maybe eat organics, maybe eat better quality foods. More natural or whole foods are important. Water, you might want to filter your water, get a water system. I like the Santivia water system, so I have that here at home. But you might want to change the water you're drinking to make it more pure and more mineral based. And the alkalinity of it is important, so you might want to look into your water and what you're drinking. The environment you live in, where you work in, sleep is very important. So those are some changes you can make to improve your lifestyle. And then last, I encourage you to have some confidence that your body can heal from the inside out, that you can actually, your body can improve, that it does have that healing ability, that you don't have to reach for exterior outside sources for your body to heal. So you just have to treat it better, you have to treat it right, and it'll promote the healing process. And that ties in very well to the chiropractic treatments and the chiropractic lifestyle. And I guess that really comes down to loving your body, like having that care and special attention for your body. It extends to taking care of others, encouraging them to improve their health, take some steps to move down the path to better health, to go get adjusted at the chiropractor and attend a chiropractor for that healthier lifestyle, that inspiration, and getting that work done, and to get stronger. So no matter what age you are, it's never too young or too old to start. Get stronger and make today a better day than it was yesterday. So we do encourage you to spread the word of what you learned today. If you're a patient of ours in the clinic, please do tell others. We are accepting new clients at the clinic. If you do want to get the book on back pain or neck pain, I'm going to put a link in the show notes right here on YouTube. Now, if you're on Instagram, you can just go to the link in the bio and click on that, and then you'll see a link for back pain, the book on Amazon, and the book called Neck Pain. So you'll see that there by clicking on the link in the bio. It'll take you to our link tree, and then you're going to see these links. So if you're on YouTube, it's right here in the chat. If you're in the US, click on this link. If you're in Canada, click on the second link. And that'll take you over to the bookstore, and my book on back pain and neck pain are in paperback, ebook, and the audiobook version. If you need more help and you want to become a patient of ours, there's two ways to do that. One is you can book an appointment in the clinic. So you can book a visit by going to this link right here. So drcarryyurq.com and /appointments. So you can go to that link, and that'll take you to our booking site where you can book an appointment. If you're not in Kelowna and you do want to discuss what you learned today further, I'll give you an opportunity to schedule a Zoom call, a 20-minute Zoom call, and you can click right there to do that. So just click on that link right there. It'll take you to a 20-minute Zoom call. On the call, we'll discuss your health, as well as find a chiropractor in your area that you can see. And if you want me to stay involved in the process, more like a health coach, I'd be happy to do that for you. If you want to join my masterclass, at the masterclass, I'm going to cover what we talked about today, but go more in depth. So instead of it being a half an hour free webinar, this is a paid masterclass, and this is 5 lessons that'll be 30 to 60 minutes each, with some homework in between to follow up on these concepts, so you can actually start to make these changes and get the extra help you need. Now, some of the masterclass packages include coaching. So if you want some one-on-one coaching, I'd be happy to do that, to follow up with you, and we can do that on a weekly basis, every 2 weeks or once a month. So there's some options for coaching as well. And at the masterclass, the first class is about the introduction and the mindset to improving your health. The second class is on nutrition. Third class is on exercise. The fourth class is on sleep and stress management. And the fifth class is just putting it all together, summarizing what you learned, and then taking those action steps to make this part of your regular routine. So if you're interested in the masterclass, today I have a special offer for you, and that's 25% off the masterclass. So this link right here, this coupon code, is good for 7 days. There it is. And you can either get that again by clicking on this link in the chat, or you can go to the link in the bio here on Instagram and sign up for our masterclass with that coupon code. And if you want to follow me, I encourage you to do that here on social media. So I'm at drcarryyurq, and that handle is across Instagram, Facebook. It's on TikTok, and on Twitter as well. So please follow us on those channels. We're very active posting some of the slides we're going to be covering at our webinars, some of the information, sharing testimonials. So please do follow me on social media. And if you're interested in watching recordings of these webinars or more the longer form content then subscribe to the YouTube channel, and please do like this video because it promotes it promotes more viewers on the YouTube and the Instagram algorithm. So make sure you like this video and give us some positive feedback. And if you're not clear on something, or if you have any recommendations or suggestions on how I can improve, please do write in the chat or send me a DM. I'd be happy to hear from you and improve on these webinars going forward. We do have a podcast. It's on Spotify, Apple, iTunes, and Google. It's called Super Healthy. So you can get updates on our webinars and more material like this on our podcast channel. So please do subscribe to that. And I look forward to seeing you guys soon, whether it's at a masterclass in the clinic or at another webinar.